Recently, we have been receiving quite a few questions in regards to how it is that the Gelfix implant is actually placed in the human spine. In order to illustrate this, we're creating this video which is purely for informative purposes. Here we have the actual Gelfix implant, and here we have a model spine. Before we actually show you how it is placed, we're going to show you a little bit of anatomy so that you can get oriented. These are healthy looking vertebral bodies and intervertebral discs. In this case, we have the lumbar spine here and the sacral spine over here. This would be L3, L4, L5, and S1 right here. These right here are the spinous processes of the spine. The vertebral bodies, as we mentioned. These are the foramina through which nerve roots exit the spinal cord to go to the body to exert their functions. And this right here is the actual space where the spinal cord runs up and down from the brain stem down to the end of the spine. So now, after sterilizing the working area, we place the patient in a face down position. The head is going to be in this direction and the feet are going to be towards this direction. What we're going to do is we're going to dissect the area that we're working on until we reach the portion of the spinal cord, or the portion of the vertebral column, excuse me, that's going to look sort of like this. Obviously there's going to be a lot of tissue surrounding this area, and what we have to do is we have to dissect an area through which we can fit the Gelfix implant to fit through one of these spaces. The Gelfix implant, it looks like this in its completely hydrated version. When we place the Gelfix implant into the spinal cord, one of these ends is actually going to be dehydrated so that it can allow ease of access into one of these spaces so that we can actually channel it through one of the spaces that we created via our dissection process. So after doing all this process, the Gelfix implant is going to fit something like this in the spine. So as you can see, the Gelfix implant is going to snugly fit between adjacent vertebrae. In this case, it is between L4 and L5. It's actually preventing the vertebrae from collapsing against each other. So there's actually a physical impediment that's going to prevent the adjacent vertebrae from actually compressing this intervertebral disc as it was prior to surgery. So as you can see, this is how the Gelfix implant is placed in the spine, and the expansion takes about 6 to 8 hours, so that it is, when it's in place, it won't be able to move in any other direction. And I also wanted to mention that there are some biomarkers in these portions of the spine, so that when we take x-ray images, whether it's days, weeks, or years down the line, we can actually see and check if the Gelfix implant is placed exactly where we placed it, and there should be an exact distance between the midline on both sides. If you still have other questions in regards to the placement of the Gelfix implant or to see whether you're a candidate, please contact us for further information.